Hi everyone. This will be an overview of changes for open enrollment for the 2022-2023 plan year, some changes and dates to remember, and then I'll give a brief overview about each of the plans that you'll make elections for when you're in Dayforce during open enrollment. The first thing I'd like to shout out is that our open enrollment will be ready for your elections or your signups beginning May 9th and ending on May 21st. Please log in anytime between these two dates to complete your benefit elections for the plan year, July 1st, 2022 through June 30th, 2023. Again, open enrollment will be available for you to make your elections beginning on May 9th and ending on May 21st. We will be offering a raffle for the first week of enrollment, so please try and get your enrollments done that first week. I'd love for you to win an Amazon gift card for either $15 or at the end of the week, we'll raffle off three $50 Amazon gift cards for everyone who has enrolled during that week. So don't miss out. The medical premium incentive is still being offered by Easter Seals. That is a $40 reduction in your biweekly medical premium if you wish to participate. The Wellwright portal is where the medical premium incentive is completed. That will open on May 1st and close on June 18th. Please log in between these dates to finish the 3 steps for the medical premium incentive. The PCP form, or the Say Ah form, is physician or preventive care results from the past 24 months. If you've had an exam between February of 2020 through present day, those exam results are accepted for this year's medical premium incentive. Please upload that completed form into the Wellwright portal. You can obtain a copy of that form from the Wellwright portal, or it will be posted in the Connect for you to download. If you have any questions or concerns regarding this step in the process, please reach out to the benefits team so we can help guide you through this. Just a few reminders when you are in Dayforce enrolling in your benefits. All benefits eligible employees hired at 30 or more hours per week are eligible for benefits and must enter your benefit elections into Dayforce during open enrollment. If you're keeping everything the same, then you need to enter the same elections. If you do not need the benefits and you're waving through the options, you need to designate that. Or if you're making some changes and you want to keep some or waive some, everything has to be entered and everyone must go into Dayforce during the open enrollment period. Please remember to add and confirm dependents. Dependents are any family members you're enrolling onto the benefit plans. This year's Social Security numbers are necessary for all dependents, so please have that handy when you are in the dependent section of Dayforce during open enrollment. This is a great time of year to review your beneficiaries. These are the recipients of the agency-paid life insurance and any optional life insurance policies that you have. Remember that you can update beneficiaries at any time throughout the year by going to Dayforce Benefits and clicking on Forms and then editing your beneficiary form there. For the medical enrollment, please have your physician's NPI number handy so that you can enter that in the medical enrollment section. This is a required number to enroll in order to complete the enrollment and to enroll you in the Blue Cross Blue Shield Vermont plan. The NPI number, or National Provider ID number, can be found on Blue Cross Blue Shield of Vermont site if you use their Find a Doctor tool, Or it's super easy if you Google your doctor's name and then put NPI number after it, you'll be able to obtain the number that way. Some quick benefit updates for this year's open enrollment. We do have a slight increase in premium, 5%, over current premium costs, which equals between $4 and $11.50 depending on what plan you're on. Again, this is an increase in over the current premiums that you're paying now. All of the updated premiums you'll be able to see in Dayforce when you make your benefit elections for open enrollment. Short-term disability is an employer-sponsored plan that Easter Seals added as a benefit last July of 2021. Still effective this year. It's an auto enrollment. The weekly benefit amount has increased from 50 to 60% of weekly base pay to a $500 weekly max for a benefit up to 12 weeks. And there is a 7-day elimination period in this plan. So benefits would begin after the 7th day of your leave time. Flexible spending has increased to $2,850 this year. There's also a rollover from last year of up to $550 of your unused flex spend money. The health reimbursement arrangement is deductible support that Easter Seals offers to employees who have services that fall under their deductible. This year, that support is increasing to $2,000, $4,000 per family. The reimbursement will be 100% after the first $1,000 of deductible has been met. Your health reimbursement arrangement will increase to the $2,000 upon your deductible reset in January of 2023. A few medical plan shout outs. I'm just going to go over the plans really, just a quick overview. More information about the plans can be found on the Easter Seals Benefits website. If you go to the Easter Seals website, click on Who We Are, Employees Only, and then click on Employee Benefits. There's a ton of information there about these plans and other benefit offerings at Easter Seals. For your medical plan, Blue Cross Blue Shield of Vermont, preventive care and all age-appropriate screenings are covered at 100%. Otherwise, you would experience, depending on what type of visit, you would experience a copay of $25 to $50. There are no-cost labs and images available if you have those in an office or outpatient settings. Again, no out-of-pocket cost to you. Urgent care copays are $50. Your deductible is $3,000 with a $6,000 family deductible max. And just another reminder that your deductible does reset January of 2023. So you will continue with your current deductible, which is $3,000, but any services that have fallen under that deductible will run calendar year, so it will expire 12/31 and then reset January 2023. Amwell is telehealth visiting. And depending on what you're calling for, you would experience a $25 to a $50 copay. Pharmacy home delivery, you can save money on copays here. So if you're interested in that, log into BlueCrossBlueShieldVermont.com and check out what their offerings are for pharmacy home delivery. It's a 1-time or 2 times copay depending on what tier your medication falls under. Vision Service Provider, or VSP, is the vision plan that's embedded in this medical plan. It offers $20 copay for preventive exams, and then there are yearly allowances for frames or contacts. More information about this plan is on the Easter Seals website and also on the Blue Cross Blue Shield of Vermont website. But vision is included with your medical plan. Also, I had just mentioned changes about the HRA health reimbursement arrangement. I'll just shout it out again. It's deductible support or reimbursement from Easter Seals after you've met the first $1,000 of your deductible. This is upon your deductible reset of January 2023. Currently, your HRA offering is 50% after the first 1,000 to a maximum of 1,000. And then in January, that will increase to 100% after the first 1,000 to a maximum of $2,000 reimbursement. The Northeast Delta Dental Plan offers preventive care at 100% with no waiting period. Basic restorative care is covered at 80%, so you would pay 20% after the 6-month waiting period. Major restorative care is covered after a 12-month period at a rate of 50%, so you would pay the other 50%. Orthodonture is covered at 50%. It's a lifetime payout of $1,000, and that's after a 24-month waiting period. The summary of benefits for Northeast Delta Dental can be found on their website, nedelta.com. You can register as a user to review the benefits that are offered. You can also find the summary of benefits on the benefits website that Anthem has. So I'm sorry, that Easter Seals has. So you would go to the Easter Seals website, click on who we are, employees only, and then click on employee benefits for additional information about the dental plan. There's also a really nice video on the benefits website created by our dental plan sponsor, Northeast Delta Dental, if you wanted some in-depth information about the plan. Blueview Vision is offered. This is a voluntary plan. The medical plan does come with vision included in the plan. However, if you needed additional vision on top of what's provided under the medical plan, or you're not enrolled in the medical plan and you would like to pick up a vision plan, this would be a great option for you. This plan offers benefits of routine eye exam at a $10 copay, standard lenses at a $10 copay. Other lenses, such as progressive, would pull a different copay, so please be sure to speak with your provider as you're making your glasses selections. The plan offers a $130 allowance every 2 years from your frames, and then a 20% discount on the remaining balance. It also offers a $130 allowance for contact lenses once a year, and that is if you do not get glasses. So it's either one or the other. After the $130 allowance, there's a 15% discount off of the remaining balance. There's also some discounts that come into play with this plan, such as LASIK. So check out the summary of benefits on the Easter Seals website to learn more about what this plan offers. Easter Seals pays for basic life insurance, short-term disability, and long-term disability benefits for all eligible employees. This is an automatic enrollment, so you don't have to make any elections in Dayforce. For basic life insurance, the agency pays 1 times annual salary for a life insurance policy. Please, when you're making your elections, be sure to click the link Show Details, which is where you'll enter your beneficiary for this policy. Short-term disability is offered at 60% of weekly base pay to a $500 per week maximum amount. The benefit pays for 12 weeks after a 7-day elimination period. If you are out of work on a leave of absence, please call the benefits team for additional information on how to file your short-term disability claim. Long-term disability is a benefit that pays at 50% monthly base earnings to a $500 per month maximum. Long-term disability is effective after you've been out of work for 90 continuous days. Easter Seals also sponsors voluntary life insurance plans for optional life insurance, spousal life, or child life. Optional life insurance is offered at 1, 2, or 3 times your salary. Spousal life is offered at 5 or 10,000, and child life is offered at 2 or 4,000 per family for children that are 6 months to 26 years of age. During open enrollment, these are not guarantee issue policies. You must complete an evidence of insurability form, which is a medical history questionnaire. This form will be sent to the underwriting team at our life insurance vendor. They will review the form and make a determination whether to issue a policy to you or not. If you are interested in enrolling in a spousal life or child life plan, you must also enroll yourself in an optional life policy. Again, please make sure you have beneficiaries listed in Dayforce for these plans. Those can be updated at any time throughout the year. Flexible spending is a great way to save some money on taxes and save some money on your medically related or dependent care related expenses. So the benefit of this is that it's pre-tax money coming out of your paycheck on a biweekly basis. The other benefit is that for the health care, you are or have access to your full election on the first day of your plan. For this year, you can roll over up to $550 of your unused funds from your last plan year into the new plan year for the medical flex spend only. So the medical flex spend or healthcare flex spend maximum this year is $2,850. You can elect any amount up to $2,850 to spend for your medically related expenses throughout the course of the year. Whatever your annual election is will be divided by the 26 pay periods in our plan year starting July 1 through June 30th of next year and be removed bi-weekly in those smaller amounts. Again, you have access to the full amount effective July 1st. If you're new to FlexSpend, this will come on a Visa card from our FlexSpend vendor, HRC Total Solutions. If you're already enrolled as a member, your current Visa card will be reloaded with your new annual elected amount. If your card is set to expire, another card will be sent automatically to replace that. Flex spend for healthcare related expenses can be used for your medical deductibles or copays, vision, your glasses, your contacts, prescriptions, and so much more. The vendor that manages our flex spend accounts is called HRC Total Solutions. Their website is hrcts.com. There is a ton of information on there about what you can use your flex spend dollars for. There are claim forms if you need them, and some additional information on how the flex spend plan works. So I encourage you to log in and check it out. The other benefit under flex spend that's offered is dependent care. This is for children that are age 13 and under or dependent adults. Dependent care costs or elected amounts can be up to a maximum of $5,000 per year. That $5,000 is divided by the 26 pay periods in our plan year and taken out in smaller amounts biweekly. Again, this is all taken out pre-tax. You will be reimbursed for your dependent care expenses after submitting proof to HR Concepts, our vendor, that you've made payment to your child care facility or your summer camp, and they will reimburse you through check or direct deposit. If you have an adult that is dependent upon you, and is enrolled in an adult program during the day so that you can work, you can also use dependent care flex spend to pay for those costs. It's important for each of these plans that you elect what you're going to spend because there is a use or lose provision attached to these plans. So if you do not use your elected amounts by the end of our plan year, you could possibly forfeit the remaining amount in your that you've elected for the year. So please reach out to the benefits team if you have any questions about these plans, so we can help you figure out, how it could best work for you. The 403B retirement plan can be enrolled in at any time. You would simply go to lfg.com, register as a new user if you have not registered on their site already, and make your benefit elections or your biweekly contribution amount right on their website. Easter Seals will match dollar for dollar to a 3% maximum. You can make changes at any time to your contribution percentage or to your investment elections anytime by logging into lfg.com. If you need to speak with a consultant, you can contact our retirement consultant, and she would be happy to assist you with any questions that you have. Aflac plans are offered, which is a really great reimbursement plan to help you with out-of-pocket expenses that are not covered by your health insurance. You do not have to be enrolled in the Easter Seals health insurance option in order to enroll in Aflac. You could be covered under another plan or a state-sponsored plan and still enroll in Aflac. They reimburse for, each plan reimburses for different things. So the accident plan covers some preventive care visits and some prescription medication, as well as a huge list of other items. The hospital plan, for example, will cover hospital stays as well as high-tech images, and then the critical illness plan covers certain critical illnesses. Again, you would, if you were to enroll and submit a claim, they would reimburse you a certain amount, which could help offset the cost of expenses that might not be covered by your health insurance. So it's a really great reimbursement or supplemental plan to the medical plan. Coverage for this is offered for you or for your entire family. More information about this can be found in Dayforce. During open enrollment, there will be a link for Aflac, which will connect you right to the Aflac website, or you can read the summary of plans that are found on the Easter Seals benefits website, or feel comfortable to call our Aflac representative, who would be happy to discuss the benefits of these plans, what each of them covers, and what might make the most sense for you. So please feel free to reach out or obtain the information from our website for more information about enrolling in this really great reimbursement program. Other benefit options to think about for open enrollment or anytime during the plan year are purchasing power. This is offered through payroll deduction. It's an online store where you can make purchases and pay for them over the course of 6 to 12 months. So definitely check that out if you're interested in that. Auto and homeowners insurance are offered through payroll deductions. We partner with two different companies. One is Advantage Insurance. The other is Liberty Mutual. If you are looking to possibly lower your auto or homeowners insurance rates, or you just want to poke around and see what they offer for Easter Seals employees, please feel comfortable to reach out to either of these companies or both to look at or check out their auto and homeowners insurance rates. Again, these benefits are offered through payroll deduction. Okay, so just a quick checklist to kind of summarize. Open enrollment, you will either enroll or waive in your benefits in Dayforce between May 9th and May 21st. Remember that you can't use the Dayforce app on your phone. You have to use the browser or log in using a desktop or laptop computer. Complete your medical premium incentive if you wish to participate in that between May 1st and June 18th. And that's it. Those are the 2 steps for open enrollment. The other options to explore can be done anytime throughout the plan year. Please do not hesitate to call us with any questions you have about benefits or about open enrollment. We are happy to assist you, and we want to make sure that you are electing benefits that you can actually use. Benefits are binding, so once you make your election, you are locked into those selections for the remainder of the plan year. The only time to make elections outside of open enrollment is if you experience the life event. Please call the benefits team if you have any questions to make sure you're electing benefits that you need. Please reach out to the benefits team if you do experience a life event during the course of the plan year so that we can help guide you through that. Thank you so much, everyone. Take care.